Yes, I'm looking for Mr. Ferguson.
Oh yes, Mr. Ferguson.
Oh,
Turd
hello.
Ferguson. Nice to
Tur-
meet you.
oh, hi. Hi, nice to meet you too. Hi, I'm a nurse here, and
Hmm.
I'm want to explain to you, talk to you about your son. Your son's name is. Do you remember your son's name?
My son Constipation. Yeah,
Yes,
yeah.
constipation.
I've
Yeah.
been really worried about him. I know he's in a fragile state, and I just really want to know how my boy's doing.
Sure, no problem. So let me just explain to you about his condition and also our plan of care for him. Okay?
All right.
All right then.
Yes, any information that you could give me would be very helpful.
Yeah, no problem. Let me actually show you what's going on with your son's condition. Okay, so here I just have regular whiteboard. I just want to draw for you. So your son, his condition is called. He has a myelomeningocele. Okay, and what that
Myelomeningocele.
myelomeningocele and all that really means is you have their spinal cord. So your son has a spinal cord, like so, right? And the spinal cord runs along our bones, our backbones, our vertebrae. So I'm just going to put like little squares here. They're not squares, but it just helps show the visual. Now, normally all these squares go all the way down until the end of the tailbone. Unfortunately, though, with your son, due to, of course, unknown reasons, although it is possibly associated with folic acid or lack of folic acid, they're missing some bones here, or some or part of the bones here. Now, what that means is that the spinal cord is exposed. So, every once in a while, if someone has this, the skin can develop what's called like a bubble, like a cyst, it's called a cystocele, and a little formation or a bubble can form, and sometimes the spinal cord and the contents stay in the spinal cord, and that's just called a meningocele. But in your particular son's case, a myomeningocele means that the spinal cord and nerves and everything actually go into the sac, and they're in there floating around. Now, this can be at any different levels, but your son's level is not too low. And then of course we have to take care of this. This has to be repaired because since all this is just skin, okay, and it's very fragile. And I'll show you your son in a minute and actually show you exactly what it looks like. But this must be repaired. If it's not repaired, the nerve endings are there can be exposed and damaged. Okay, so next we're going to go and show you your son.
All right, great.
So Turd Ferguson, this way is your son. Constipation, you see he's sleeping very soundly. And I just wanted to show you um, the actual sac, the myomeningocele. And as you can see here, it's in his lower back. It is protruding. It's on the outside of the body. And the sac is filled with fluid. And the fluid is just suspending the actual nerve endings and spinal cord. And you can actually see the spinal cord floating in there. Do you see those lines there right there? Yeah, so that's the actual spinal cord just floating in there gently. And so those are the spinal cords that can be damaged. And so we have to surgically repair the the actual sac. And for now to care for it, because we don't want it to rupture, he must lie face down as he is now. That way he's not putting any pressure on the sac. And we must keep him warm so that he doesn't get too cold, and hydrated as well, so the sac doesn't get too dry out and burst. And we have to clean the sac, keep an eye on it. And to clean the sac, we use just normal saline solution, and of course just sterile gauze. And we just clean it with some sterile solution, like so, and then place the gauze and clean it like so.